Hi, my name's Alicia. Nice to meet you.
Nice to meet you, Alicia. So, you want to tell me a little bit about yourself?
And a recent Ithaca College graduate, and I'm really interested in a position that Kessler has offered for the neuro full-time physical therapy. Just a little bit about myself is that I chose the profession of physical therapy because I was really interested in the aspect of physical therapy and that I was able to be very involved in someone's rehabilitation. I was able to impact their lives, and really I just found that very rewarding and very fulfilling, and I thought PT fulfilled all the criteria of just helping someone, and also in return it just encourages me to be a better person and me just trying to help out as much as I can for anyone. And then if I don't work, it'd be really nice if I could just travel. I like to see the world, to meet new people, to experience all different cultures. And obviously I can't always travel, so any good hikes are always a good idea for me. And the most memorable hike I've had was actually when I was in Colorado, and we did a 14er, and the view was just breathtaking. So I'm definitely down to do that again anytime.
Oh, that sounds really cool. Do you want to tell me a little bit about your strengths and weaknesses?
So I think my strengths, I would consider them, are just being friendly, personable, and just patient. People will tell you that I laugh a lot, and I take any time I can, I'll be laughing, just because I find that laughing is contagious, and also it just lightens the mood. And that's what I want. I want my patients to be happy, to find therapy not as something grueling that they have to go through, but as something fun and as something that they're spending their worthwhile time rehabilitating while having fun doing that. And I just want my patients just to trust me, to just be open and honest with me, so that I can benefit them in any way possible, and they just feel safe around me and the environment when they're just recovering. Mm-hmm. And then consider a weakness is that I'm inexperienced, which makes me feel less confident and exude less confidence, or not as confident as I would like. But I find this also something that will drive me to stay on top of the current research, to always going to continuing ed classes, and to just take any opportunities that I can get, so then I can be more experienced and that I just have like more of the current knowledge, and so then I just feel more able and capable to provide the best type of treatment that I can for my patients.
Okay. So what interests you about this job?
So I thought this job, this population, I find that it's a very fulfilling population to work with, just because they do have a lot of challenges that they face, and just the simplest task of just walking is an incredible goal to achieve, a goal to achieve. So I find that even any small wins of maybe just taking one step forward without assistance is an insurmountable joy for the patient, and that also translates to the therapist, just because it feels really good to be a part of someone's rehabilitation to help them get to that point where they want to be. And I chose Kessler because I know Kessler is really well known, and that they provide very much up-to-date technology, and it's in a very nice area, so definitely lots of pros for Kessler.
I'd like to hear that. What experiences have prepared you for this job?
So I did a couple of clinical grand rounds in Ithaca College, and for one of them I worked with a chronic stroke patient with another PT student, and we just worked a lot on the patient's gait, and the patient did make some gradual progress in that we were able to provide less assistance, and also we were able to encourage the patient and to make the patient more aware of their body, so they would be able to activate their muscles better, so then they could hold their balance better, so then they could do transfers a little bit easier, in that they required less assistance. And then most recently I worked in a aquatic therapy research program, so we work with chronic stroke patients again, and it's just amazing to see the differences from day one of the program or from day one of the study to the end of the study, because we have some patients who are max assist on the first day, but then by the end of it, they can take like 10 steps by themselves in the pool. So it's kind of an amazing thing to see.
Where do you see yourself in the next 3 to 5 years?
In the next 5 years, I'm thinking that I would be a certified neurological physical therapist, and I'll just be happily working as a full-time physical therapist in Kessler. Um, Other than that, that sounds about it.
Okay. Do you have any questions for us?
I actually don't at the moment, but I'm sure the more we talk that there'll be questions that come up.
Okay, sounds good.
Thank you.